Hello, this is a summary of the Trinucleotide Repeat Disorders lecture that was delivered on October 15th, 2025. Overview of repeat expansion disorders. Uh, this is a group of genetic disease caused by expansion of short DNA repeats. The repeats can be CGG, CAG, CTG, or GAA. Typically affects nervous or neuromuscular systems. Categories by inheritance, autosomal dominant. The disease that was covered is Huntington's disease and muscular dystrophy type 1, autosomal recessive, Friedreich's ataxia, X-linked included Fragile X syndrome, Fragile X associated tremor and ataxia syndrome, premature ovarian insufficiency syndrome, and spinal bulbar muscular atrophy, also known as Kennedy's disease. So one of the unique features of repeat disorders is anticipation. What that means is the age of onset is earlier in successive generation and the disease is severe, the phenotype is severe. These expansion can happen in the coding region, in the untranslated 3' and 5' regions, and also in the intronic region. What are the underlying molecular mechanisms? It can be a loss of function mutation or a gain of function mutation can happen at DNA, RNA, or protein level. One of the unique features of Fragile X syndrome or FMR1 gene mutations is this pre-mutation, that is, the repeats range from 5 to 200. The patients don't have Fragile X syndrome, but they could. Fragile X associated tremor and ataxia syndrome can develop in older males, that is over the age of 50, and females also could be affected by FXTAS. In general, FXTAS symptoms in females are less severe and often appear at a more advanced age compared to males. In premutation carrier females, they are prone to premature ovarian insufficiency, that is, their menses stop before the age of 40. FXPOI occurs in less than 1% of the general female population, but up to 24% of FMR1 premutation carrier females. So what is, in terms of X-linked disorders, why do they affect males and females differently? So let's talk about SBMA or spinal bulbar muscular atrophy, also known as Kennedy disease. It manifests only in males. Females are protected from severe SBMA symptoms because of their low level of circulating testosterone, leading to decreased androgen receptor stimulation. This is again a CAG repeat disorder. The protein is formed, but that protein that's formed, that's the androgen receptor, it requires its ligand, which is the testosterone. In females, it's present at a low level. That's why the female carriers are not affected, whereas males have a high level of testosterone, and therefore it would manifest in males. On the other hand, Fragile X syndrome, we have to think about X inactivation pattern. It affects both males and females, though females generally have a milder phenotype. And the reason for that is females have 2 X chromosomes, and generally one chromosome is capable of producing the protein. Although the dosage is insufficient, it can restore full FMRP function or the Fragile X protein function. In terms of disease severity, it may be affected, especially in females. It is affected by X inactivation. As you know, females have two X's, whereas males have one X. So in terms of females, if the normal X is inactivated versus the abnormal X, or when I say abnormal, it means the FMR1 gene that is methylated. If the normal X gets inactivated, that means it reduces the protein level, and if one doesn't have enough protein, that would compromise the phenotype, and instead of they showing milder phenotype, now they have a severe phenotype. Huntington's disorder is an autosomal dominant condition. The underlying molecular mechanism is toxic polyQ protein, that is, there is expansion of glutamine, CAG repeat. There is anticipation, and something that's important is the expansion happens during paternal meiosis. So it happens in the father more than the mother. So the bias is towards paternal meiosis expansion. Myotonic dystrophy type 1, again, autosomal dominant. This one is because it's in the 3' UTR region, it's not a coding region. Instead, the RNA is the driver here. It's toxic RNA that sequesters away ribosomal binding proteins that are important for translation. Again, in this disease, there is maternal bias. The expansion happens during maternal meiosis. Friedreich's ataxia syndrome. This is an autosomal recessive condition, and the molecular mechanism is gene silencing. Both parents have to be carriers. In terms of Fragile X associated tremor and ataxia or premature ovarian insufficiency, FMR1 gene is on chromosome X. It's X-linked. In this case, when it comes to Fragile X syndrome, there is complete loss of function, no transcription, no translation. However, with the premutation carriers,
the repeat size is 55 to 200.
There is an increase in mRNA expression in these patients, and this is what causes the problem that's associated with males developing Fragile X associated tremor and ataxia. And in females, they could have FX tax, and in addition, they could develop premature ovarian insufficiency, which is, compared to the general population, it's much higher in these females who are the premutation carriers. In terms of SBMA, again, this is X-linked. However, this is different than Fragile X, which happens in the 5' UTR. SBMA, it is because of expansion in the coding region. It affects males, but female carriers are not affected, and the reason for that is males have testosterone, which is a ligand for the androgen receptor, and if one doesn't have enough testosterone, that activation of the pathway doesn't happen. What is unique about SBMA is that in SBMA, expansion is extremely rare. Contraction can happen, and if a person carries an expanded or the abnormal repeat size, that is 38 or above, anything at the lower end, there is a good chance that with in successive generation, they might undergo contraction, and in a couple of generations, they might revert back to this. In this family, the repeat might revert back to normal. So some of key takeaways, unique feature that is associated with repeat disorders, triplet repeat nucleotide disorders, anticipation, that is age of onset is younger and in successive generation, and the phenotype is severe. Mechanistic diversity, it can be toxic protein, toxic RNA, or due to complete loss of function. Diagnostic correlation through repeat size and inheritance mode. FMR1 full mutation, decrease or no FMR protein. HTT or Huntington's repeat, it's a CAG repeat. Autosomal dominant with anticipation. Friedreich's ataxia or frataxin is the gene, GAA repeat. Friedreich's, it's an autosomal recessive condition. DMPK gene, CTG repeat. Myotonic dystrophy type 1. Androgen receptor, again, a codon. CAG expansion, polyQ like the Huntington's, but this one is X-linked. What it does, it results in reduced male fertility. So this is just a quick glance at CAG repeat, codon, Huntington's disease, SBMA, GAA, Friedreich's ataxia, it's in intron 1 of frataxin gene, CGG, it's Fragile X syndrome, FXTAS and POIS, and then CTG, 3' UTR, and that's myotonic dystrophy. Thank you very much.